Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas.
Hey everybody, it's Dr. Reiser, another Whiteboard Wednesday, and today is our season finale of vitamin Bs, where to get them, how to know if you're vitamin B deficient, what they all do individually, and the two biggest vitamin Bs that we always hear about is today's topic of conversation, vitamin B9 and vitamin B12. So we're talking about folate/folic acid and your cobalamin, your vitamin B12. These are probably the two most important vitamin Bs because they do so many things, and a deficiency in both of these or one individually causes significant health problems, especially vitamin B12 because it is one of the vitamin Bs that we have a major deficiency. I believe it's probably around 40% of individuals worldwide are deficient in vitamin B12 and lead to significant chronic health conditions. So let's dive into these, see how we can improve our B9 and B12 status. How do you know if you're deficient and what foods to get them from? And we're going to start with your B9 folate. And the biggest thing that we want to talk about with folate or vitamin B9 is this folic acid that continuously shows up in our supplementation. Now, folate is going to be the food-derived version of vitamin B9. That is the version that you want. That's the version that will actually activate inside the small intestine. So as we look through our chart here on the left, folic acid is the synthetic version as compared to the folate. Now, we started to realize that deficiencies in folate were causing neural tube defects in children during pregnancy and obviously after pregnancy and during birth. And so what we did in the 1980s as a country is we started to fortify our foods with folic acid, this synthetic version that we were creating so that we would stop this neural tube defect issue in our children. Now, it has certainly significantly decreased the amount of neural tube defects, but the issue is folic acid is synthetic. So what is happening is it's causing health problems now. So what's the difference? Folate, like I said, is natural. It is synthesized in the small intestine and can immediately get to work. The folic acid, on the other hand, has to be synthesized and methylated in the liver. And a lot of people lack the enzymes necessary to do this. So what will occur is folic acid will actually increase in the bloodstream. And you might think, well, that's good that we have high folic acid, but it's not. High levels of folic acid have been linked to several chronic health conditions and especially cancer. So the common cancers that we're looking at with folate will be prostate cancer, colorectal cancer, and the reason that these cancers start to come with high folic acid levels is because folic acid actually decreases the amount of natural killer cells in your bloodstream as the folic acid goes up. Natural killer cells kill cancer. So if you're eliminating those cells, you're actually decreasing the ability of your body or inhibiting the ability of your body to fight off cancer. The other issue that we have with folic acid, high levels of folic acid in the bloodstream, it will mask vitamin B12 deficiency. So when you're getting lab tests and these different markers, it will show possibly that you have adequate B12. In reality, you don't because there's high folic acid levels. And we're going to get into B12 deficiency symptoms here later on. But the last thing that we're going to touch on the bullet point here obviously is the neural tube defects. So that's the one good thing. And if you're a person that you might feel like you're vitamin B9 deficient, you want to get these types of foods in there: romaine lettuce, spinach, asparagus, mustard greens, broccoli, beets. These are all going to be the vegetables that will have high folate, not folic acid. And the main thing that folate does, aids in development of red blood cells, reduces levels of homocysteine. So this is a big one for people that have heart disease, cardiovascular disease. High levels of homocysteine in the bloodstream cause heart attacks, strokes. So folate actually will methylate and break homocysteine down for you, and that lowers your heart attack risk. And this is one marker that I always run on individuals so we can see their folate and their vitamin B12 status. That marker you must have low. Ideally, I like to see it below 10, even below 7 on your lab tests. So if you have any old lab tests, look through back there and see if your primary care physician or your specialist has looked at that. Last but not least, it supports nervous system function. So this is where we sometimes get the cognitive impairment issues with lack of folate, lack of folic acid, if you will. So last but not least with this, You want to supplement adequately and appropriately. So folate is what you want, and specifically 5-MTHF. If your supplement does not say 5-MTHF on it, you need to get another supplement. Ditch the supplements that have folic acid, especially if you're somebody that is MTHFR, you have that genetic variant. Look that up, MTHFR, if you don't know what it is. But this genetic variant makes it very hard for you to methylate things properly, use folate properly, B12 properly, and folic acid is not going to help this situation for you. It might make things worse for you. Do not take folic acid. You want to get the folate. As far as how much you should dose, for majority of people, you're going to look at 400 micrograms. For women that are pregnant or trying to get pregnant, 600 to 800 micrograms is where you would want to end up. And so that is vitamin B9, folate. We're going to go into vitamin B12 now. Now remember, these are connected. So if we're masking vitamin B12 deficiency, here's now what vitamin B12 does, and you really should take these together symbiotically. So moving on, vitamin B12, cobalamin, probably the most talked about vitamin B that there is out there. Works with folate to synthesize DNA and red blood cells and protects myelin sheaths and nerves. So those areas that it's affecting, you can now see why if you're deficient, it leads to our next bullet point here, which is going to be the issues or symptoms that you have if you are deficient. Brain and cognition issues, anxiety and depression, bipolar disorder, fatigue, autism spectrum disorder in kids, multiple sclerosis, and heart disease, cardiovascular disease, stroke, heart attack, those types of things. B12, especially the nerve function, it helps with cognition. That's why you're seeing many people end up with Alzheimer's and dementia, and it's linked to them having a vitamin B12 deficiency most of their lives. So this is a very important vitamin for cognitive impairment. So with B12, medications that you would want to see or that will cause deficiencies, so if you're taking these medications, you want to check your vitamin B12 status, PPIs, metformin for diabetics, and really any acid reducer overall decreases your absorption of vitamin B12. And as we see, type 2 diabetes is linked to what? Alzheimer's and dementia, and people that are on PPIs, omeprazole, and those types of things typically have low vitamin status anyway. So if you're taking those, you definitely want to supplement. Alcohol decreases absorption, and any kind of major alcohol consumption, B vitamins overall typically go down, so that's something you want to watch out for. And veganism. Our vegans, our vegetarians always have low levels of vitamin B12 because you can only find B12 in meats. Okay, and I know that there are a lot of vegans out there and vegetarians that say, no, you can get it from brewer's yeast and you can get it from seaweed and stuff. Untrue. You have to get vitamin B12 from meats. This is one of the big arguments having for meat eaters as opposed to vegans. Now, I'm not saying that veganism is bad. I respect everybody's beliefs. You can eat however you want. However, if you're going to choose to eat that way, you need to make sure that you supplement with vitamin B12 appropriately, okay? You have to replace vitamin B12, especially kids. There's been a lot of studies, and that's why I have this up here. Children raised vegan had a significant deficiency in vitamin B12, and when they took those kids and reintroduced meat, it took even years for them to get their vitamin B12 statuses back up. And they're finding that kids with low levels of vitamin B12 typically end up on the autism spectrum. It's a very important vitamin for cognition. I can't say it more times through this little Whiteboard Wednesday. So what we want to do with this is figure out, okay, what are other ways we can pinpoint maybe if we have a deficiency other than obviously our diet or anything like that. The biggest one we see in the office is going to be gut disorders, Crohn's, leaky gut, stomach acid issues, pernicious anemia, which is an autoimmune disorder. These people have issues absorbing B12. If you have heartburn, those types of things, you're going to have a hard time absorbing B12. You're not breaking your meats down. So that's the number one I see usually in the office. So if you have any of those symptoms, if you have gut symptoms, you should be supplementing with B12. The other thing is at your doctor's office, you are not getting tested appropriately for your vitamin B12. If we compare two countries, United States, and we compare it to Japan, Japan has one of the lowest incidences of Alzheimer's and dementia in the world. The United States has one of the highest. United States, when they do your vitamin B12 status, they typically say 200 to 350 is a low, normal, and acceptable. They want you at least there. Japan, on the other hand, wants you at least around 600 and above, and they will give you high dose B12 to keep you above there. Now, all these studies that we're seeing with Alzheimer's and dementia with vitamin B12, there's a perfect example right there of correlation, causation, and correlation, and cause and effect. If we have lower B12 levels as a society, but higher Alzheimer's and dementia, and Japan has higher B12 levels and lower Alzheimer's and dementia, there we go, case in point. So we want to make sure that when you're getting your vitamin B12 run through your doctor, you ask them, can I get this any higher? I know 200 to 350 is a little bit low. Try to get over 600. Europe even uses 500 to 550 as their minimum. So every other country on earth, except for us, go figure, 47th in the world in healthcare, uses a higher B12 level. So try to get over that 600 mark. Or what I like to do is I test through the urine, through something called methylmalonic acid. That's going to give us a great look into how well you're utilizing B12. This is a substrate in the enzymatic process of how B12 is used. This is urinated out, and it gives you a really accurate look at your vitamin B12. And we use this on one of our tests here to see whether or not people are detoxing properly. So if you're going through blood, 600 and above. If you're doing urine, MMA or methylmalonic acid is the ideal, and I would argue probably even better than your blood. So to finish up with your vitamin B12, what foods can we get through? Seafood, meats, and livers are going to be one of the best ones. Chicken liver for sure. Obviously, like I said, with the vegans, make sure you're supplementing if you're not eating meat. And here's the versions of the B12 over here. Now, as we see over the counter, you're going to get things like cobalamin. That is the number one most, most prescribed in your over-the-counter vitamin B12s, but you have to look at absorption. Methylcobalamin is the highest absorbing vitamin B12, followed by hydroxycobalamin, followed by adenosylcobalamin if you have methyl issues. So I always start people with methylcobalamin because it's the most easily absorbed one, and it actually just bypasses everything and goes right into the bloodstream. Or if you're somebody that has the MTHFR like we were talking about with folate, and you have problems with these methyl donors, basically what's happening with the methylcobalamin is it's being introduced to the body with a methyl group on it. So the cobalamin or the B12 uses the methyl to bypass different processes in the body. But if you're somebody that has methyl issues, methylization issues, genetic issues, MTHFR, that might be too much methyl for you, and it will make you feel crazy, mood issues, brain issues. So you want to remove that methyl group and give your body something like adenylyl B12, because that will introduce B12 but without the methyl group. So those are all your versions. If I were you, and even in my practice, I never hardly ever use cyanocobalamin, always methyl, hydroxy, or adenylyl. And then we see what the patient reacts to best. I've had some patients where we've gone side by side methylcobalamin and then tried adenylyl, and the adenylyl was the only one that actually made a difference and a dent in their vitamin B12 status. And as far as a dosage, an easy dosage for you would be 1 gram daily as a minimum. If you do have issues that you need therapeutic benefit, you can obviously talk to a provider, a practitioner like myself, and we can monitor you and give you some really high therapeutic doses over a period of time and see if we can make a dent, whether that's the homocysteine levels, cognition, brain issues, autoimmune conditions, MS. We have several of these patients that require certain therapeutic doses of vitamin B12. So that rounds it up here, guys. If you have any questions about vitamin B12, make sure you DM us or email us. Folate, DM us or email us. Next week, look for another Whiteboard Wednesday. Going to be a different topic. If you also have an idea for a topic that you want to use, please DM us. We will put anything up that you guys need to have answered. And have a great day, everybody.